The last few months I've received a few emails about this new device, ASV, Adapto-Servo Ventilation, and whether or not it might be useful in insomnia patients. And I have to say that we don't have much research yet, but it is something that we're looking at because we're seeing it in a slightly different context than insomnia per se. We're seeing in the context of there are patients who can't use CPAP, they can't use BPAP, they can't use auto CPAP, they can't use auto BPAP, and there's nothing left really for them to try that would be a reasonable option. Now, why do these people fail it? They may have problems with aerophagia. I just saw a couple patients this week where they're swallowing too much air. But a more common one is simply they just don't adapt to these other devices. There's just too much arousal activity. Is the arousal activity something like cyclic alternating pattern, the CAP phenomena? It's very possible. But the point is, just from a purely clinical perspective, they can't adapt. They can't get a good airflow signal. There's still lots of arousals, and these patients always report the same thing. They don't feel the machine is helping them that much. They don't feel that rested in the morning. There's not much change in their daytime fatigue and sleepiness. Well, in that case, all of those other devices would be called failures. And the question is, can you then apply for a new device, which is different, that might provide a response? And that's what we're going to begin to look at in several of our patients who are having this kind of problem. And we've seen a few already who've tried the ASV, and they do report that it's better. And it will be interesting to see how the insurance companies deal with this, because the traditional model of using the ASV was strictly for these problems related to central apneas. However, what we're postulating here is that perhaps if you have come to the end of the line with all the other devices and now you only have ASV left to try, and it in fact produces a good response, why wouldn't the insurance company want to cover something on the device? Because a treated sleep apnea patient, as we all know by now, is a less expensive medical patient based on all the theories and data about how treatment of the sleep apnea will reduce your costs going forward. So we're looking forward to that, and I hope to have more updates on this topic.